So I'd like to introduce you to two particular varieties of blood glucose monitor. The one that you will have for practicing and assessed on today will be this one, which is the Glucose RX Nexus, which is this device here. These are really commonplace around the community, and they're kind of a default thing for many areas. They will be issued, these people with diabetes will be issued this device and these test strips. It'll all be issued probably through the diabetic nurse specialist. The other one here, which is a Freestyle Optimum Neo H, that's the type of thing you will see with your community nursing team, that kind of thing. These are sort of standard issue in your area. I won't worry too much about these. It's just to show you that there's a variety of them. If you go online and look for blood glucose monitors, you find any number of them. So the important thing to remember is that they will be issued as per whatever the community diabetic nurse specialist has on their order schedule, so to speak. So there will be a fairly standard issue. People can go and buy whatever devices they like, but do bear in mind that the most expensive element of all this is the test strips. The test strips, they come on prescription, and you could expect to pay a lot of money for a pot of test strips like this. So yeah, they come on prescription, so you don't have to worry too much about the cost of them. So let's just bring let's bring this device in. Okay, a few things to think about with this is that the screen has to be a good size, because sometimes people who are operating this themselves need to have a good view of it. If it's too small, if the readings are too small, they may struggle to see them if their eyesight is deteriorating with the continued onset of diabetes. Now, to switch one on, if you're going to use it for a blood test, a single blood test, you'll need you need a test strip. To switch it on, you need to take a test strip out of the pot, and you do that by putting your finger inside and drawing one out from the middle. If you look at it, there's two distinct ends to this. You've got the end that goes into the machine, which has got the electronics on it, and the end, if you look very closely, has a small symbol of a blob on it and a tiny, tiny little line in there. Now, the amount of blood we need is actually only enough to go in there, and it's a micro milliliter of blood. It's a tiny, tiny amount. So we hold it by the middle, try and avoid touching the ends if you can, and then when you slot that into the machine will switch on. When it switches on, it does a routine check, and then we come back to this symbol again of a drop. And this is saying now that there's a drop needed on there in order for a blood glucose reading to be made. It only needs a tiny amount, and this works on a capillary action. So what you'll see in the video where you see this being done on myself is that the capillary action draws the blood. I can demonstrate that just by putting a blob of fake blood on there. Okay, get used to the fake blood, because I'll be sending that to your home, so you can test this. You can do this without having to finger prick yourselves. Okay, so there's a little blob of fake blood on there, and you watch. It's hard to say from here, but if you put that in, you might be able to see it coming up the tube, up the little line in there, and it just draws it up. You don't have to scrape it up; it just draws it up. Now that's the fake blood, and that's reading 8.2 on there, which is what you'd expect it to be. So just to show you, that's capillary action. So you need to go in at a sort of right angle. It will draw up what it needs. You don't need to scrape it up. You don't need to blob onto it. You just need to let it draw as much blood as it needs, and you will, with a typical size blob of blood like that, if you've managed to get a blob of blood like that size, there's probably 10 times more blood than you need there. So you don't need to worry too much about having enough to test. In the old days, as a student nurse, we used to have to test using 2 very big pads, which were like the urine testing pads, and we used to have to test it by putting a huge blob of blood on it, and then wiping it off and then timing and so on. What we have now is a very sensitive test, and it only requires a very tiny amount of blood. Once the sample has been drawn and the machine has given you a reading, just repeat the point that you need to look at the reading and see how it fits into the overall condition of the patient, of the service user, whether it looks kind of around about the same sort of reading that you've had before, and it's not if it's too far out from what you've been getting, whether actually that is showing in your service user. If your service user's showing signs of having very high or very low blood glucose, the reading may be confirming that for you. If you're finding something way out of the ordinary and the service user looks fine, appears fine, you may need to retest it just to confirm. Okay, so again, we can just fire this out. This is just a sharp spin. So I'm just going to press the trigger on the side, and it shoots out. You can probably shoot it out from a distance if you wanted to, but yeah, just when you've got any blood involved, just get it out of the way. Anything with blood, sharps, anything like that. If you've got a little swab, that can just go into a yellow bag if you have a yellow bag. But again, tissue is pretty good because you can flush that. Okay, so anything else about this? I keep saying about this fake blood. Oh, let's just go back to the strips first. These will only work with their own strips. So you can't use these strips on this machine, and you can't use these strips on this machine. They are compatible. And it's like I said earlier, the thing to remember is that this is where the money is in terms of what the cost and the manufacturers, how they make money out of this. So the test strips are really important. Now these are for training only because they have actually expired. But for testing purposes, for training purposes, we tend to acquire the expired stock, or as close to expired often. So it's important we treat these little pots like medication, really. They should have an expiry date. Just ignore that one a little bit for today. So let's just say when you're testing your service user, you would expect yours to be in date, not like mine, which are, as I said, for training only. So rest of it, if they're in date and they fit the machine and they're right for the machine, then that's fine. Again, just to reiterate, we don't tip them all out, so like so, and we try and touch as little of them as possible. So there we have, having taken them out, we try and just hold them by the middle as much as possible. Like I said before, we pop that into the machine, and that switches the machine on. Okay, so there's your and once they're used, obviously they need to be thrown away. You can't use them. You sometimes do get errors on these machines. Now every machine will have a threshold for error, and the most common error is insufficient sample. Even though I've said that the machine takes a very tiny amount, if that tiny amount is really insufficient, then it will tell you so. So I'm going to just load this one up and demonstrate to you what I mean. So I'm going to use a bit of fake blood on there. So I'm going to do what sometimes we do which is we've got a sample of blood and we've messed about with it and we're not quite sure whether we're going to quite have enough. So we're going to get a little bit on there and let's see if we can make it do an error. So it's not going to quite have enough, I don't think. And I'm going to make it go into an error. So there we go, error. When you get an error code, there's two ways of doing it, of responding to that. Firstly, you might already know what the error code means. But if you don't, go to your manual, okay, and it will have error codes in it. So let's go to where the error codes are. And we had error F, didn't we? Okay. EF says here, appears when test strip is removed while counting down or insufficient blood volume. And it says what to do, review the instructions and repeat test. With a new test strip, if the problem persists, please contact your local customer services for help. So it's really important that you don't, when you get one of these machines and it's got its nice little case and so on, that it doesn't just sort of sit there in its case. It doesn't sit there in its case, and we don't just throw the box away. So the box contains lots of information, lots of information here, and all these will come with it. It's not like you're going to you'll get a sealed box when you first start using it, and there's all sorts of stuff in here. But the most important thing that you're going to probably need is your owner's manual. Okay, so you would need to then familiarize yourself with that. There are elements within this that require you to test, to do a quality assurance test. And the advice I will give you for that is that when you get a new set of when you get a new pot of strips, use the first one to test. Okay, and the reason we do that is for a quality control reasons. We don't know whether, I mean, if they're faulty, that could cause chaos. If they're faulty, let's say they're overreading, they're under-reading, and in response to doing a test, let's say your service user ends up in hospital or ends up, having treatment that is not required, and some harm comes to them, then obviously that's really serious. So what we have is what I call fake blood, but it's a test solution. So the test or the control solution we use to test whether the strips are reading true. So we take a strip, take it out. This is the first one, or we either take the first one out when we get a new pot. Depends how often you're using this. In your care homes, you should have a designated person who documents that this test has been done. This is a piece of medical equipment after all, and it's important that you can show an audit trail that it's been tested. If you're only testing somebody's blood once a day, clearly it's going to take a while to get through 50 strips. So if you're only testing it once or twice a day, that's 25 days. I would suggest that you get into the habit of testing it maybe weekly. Okay, so doing a test every week, designate somebody to do that. No, it doesn't have to be everybody's job, but as long as somebody does it and it's documented, that's important. And this is what you do with this particular device. You take your control solution, you put a blob in the top of the lid, like so. You take your machine and you draw a little bit of control solution out, upside down, and it will give you a reading. If that reading is within the range shown on the container, which it is, then that passes its control test. And we're happy with that. So, you can use these machines to do monthly averages. You can use them to do you can set them on a control mechanism so that they recognise that you're doing a control test. to be honest, I'm not going to go through that today. What I would suggest to you is if you're instructed to do a weekly average, then you will need to refer to the handbook. If your community nurse specialist has asked you to do that, you'd need to refer to the handbook or seek advice from them about actually shifting it between modes. But for the purpose of today, I think it's important that we just recognise we'll leave it in the single mode, otherwise it'll get very confusing. Final thing to say about this machine, normally when you've done a test, let me just show you, once you've done a test, that'll flag up as an error because it's been used. He says, yeah, so error U, which comes up as used in the book. So if I guarantee U means used, just to prove it. Confident to find it somewhere. A good teacher would have the pages marked. Error 37. Do apologise. Talk amongst yourselves. EU, there you go, appears when the used test strip is inserted. So that is showing as EU. Okay, so what you'll notice is the machine's turned itself off. Just go back to switching the machine on. The first way of switching the machine on, as we say already, is to stick a strip in. And again, this one's going to show up as an error. That switches the machine on. You take that strip out and the machine should turn itself off eventually. However, if it doesn't, you can press and hold and it'll go off. If you then switch the machine on without putting the test strip in, you can press the button and it will come on. If you press it again, it will give you the most recent reading. If you press it again, it will give you the second most recent reading. If you press it again, it will give you the third most recent, and so on. And it will keep a memory, and it will tell you the times that those readings were last, when they were taken. Okay, so if you look along the bottom here, and this is the mode it's in, it's a general mode, and this is the measurement here in millimoles per litre, which is how we measure blood glucose in this country. Okay, and press and hold to switch off. Final thing about this is that when you are using this, especially in the current climate, it's important to make sure it's clean when you're finished using it. So give it a clean down. If your current situation means that, now if you're going to use this on more than one person, I would be suggesting that you don't put it in a pouch. But because you're probably going to be using it on one person, then it can go back into its pouch, and it all sits very nicely in there. You see what I mean? And you can seal all that up. But if you are going to use it on, more than one person, just on the chance that that is the case, then at the moment I would recommend that you don't put it in a case, and it's cleaned and probably kept in a plastic bag, and it's cleaned between use with surface wipes. Okay.